My hands are clean. I've provided for a private environment. Hi, my name's Deanna. I'm a nurse practitioner student. How can I help you today?
I'm here today for my physical exam, annual physical exam.
All right, great. Can you tell me your name and your birthday?
My name is Alfred Severe. My birth date is March 25th, 1975.
All right, do you know where you're at?
Yes, I'm in my doctor's office.
All right, and can you tell me the date?
Today's April 13th, 2025.
All right, and are you in any pain right now, Alfred?
No.
Okay, so the patient is alert and oriented ×4 and no acute distress. Posture is upright, well groomed and well nourished, appropriate for the situation. Throughout the exam, I'm going to be checking your skin for any lesions, wounds, or concerning moles. Mm-hmm. Currently, skin is warm and dry, tone is even, skin turgor is brisk. Looking at your face, everything, I don't see any deformities. Features are symmetrical. Can you smile for me? All right, puff out your cheeks. All right, and raise your eyebrows and close your eyes real tight. All right, cranial nerve 7 is intact. I'm gonna touch your head here. Mm-hmm. All right, I don't feel any lumps or bumps, any tenderness?
No.
No. Hair is evenly distributed, appropriate for age. I'm gonna feel your TMJ. Open up your mouth and close it. All right, there's no clicks or crepitus felt. I'm gonna check your sinuses. Frontal sinus is here. Any tenderness?
No.
All right, and then your maxillary sinus, any tenderness?
No.
All right, I'm gonna check your lymph nodes while I'm here.
Okay.
I'm gonna start with your preauricular, your postauricular, occipital, tonsillar, submandibular, submental, anterior cervical chain, and the posterior cervical chain. Any tenderness?
No.
I felt no lymphadenopathy, no tenderness felt by the patient. Okay, trachea is midline. Just your senses here. I'm gonna touch you. You tell me if you feel sharp or dull.
Sharp, sharp, dull, dull, sharp, sharp.
And does it feel the same on both sides?
Yes.
All right, cranial nerve 5 is intact. Next, we're gonna look at your eyes. So the exterior structures of your eyes, I don't see any swelling, no drooping, no drainage. Looking at your sclera, it's nice and white. Your conjunctiva is pink and moist. I'm gonna do an eye exam. I want you to read, covering one eye, the lowest line you can read.
LTFPH.
All right, and then do the other eye.
LTFPH.
And then uncover both.
LTFPH.
Great, so the patient has 20/20 vision and cranial nerve 2 is intact. All right, I'm gonna check your pupils right quick.
Okay.
All right, I'm gonna shine the light in your eyes. All right, pupils are brisk, 3s, equal and reactive to light. All right, follow the pen in and equal to accommodation. All right, follow the pen inside. Don't move your head. Good. Extraocular movements, fluid, no evidence of nystagmus. Cranial nerve 3, 4, and 6 are intact. I'm gonna look in your eye with the ophthalmoscope.
Okay.
Okay. All right. Look at the blue bonnets behind me.
All right.
Red light reflexes observed. Retina, vessels, optic disc, all without abnormalities. Look at the light, and macula is seen. Go this way, look at the blue bonnets. Okay. Red light reflex is present. Retina, vessels, optic disc are observed without abnormalities. Look at the light. And then the macula is observed when he looks at the light. Good job. All right. We'll look at your ears next.
Okay.
And then looking at the exterior structures of your ears, I don't see any swelling, any redness or drainage. Palpate your mastoid process. Any tenderness?
No.
Okay. Look inside, pulling back and up on the ear. All right. The tympanic membrane is pearly gray. There's no redness or swelling. Landmarks are observed. Any tenderness back here?
No.
Tympanic membrane is observed pearly gray, no redness or swelling, and landmarks are observed. Alright. Next, I'm going to look in your nose. Can you close one nostril for me? Take a breath in. Alright, and then close the other one. Take a breath in. And then both nares are patent bilaterally. I'm going to peek inside with the light. Have you had any runny noses or stuffiness lately?
No.
Okay. Pink, moist turbinates are observed. And on this side, pink, moist mucosa and turbinates are observed. Alright, I'm gonna look inside your mouth real quick.
Okay.
Say ah.
Ah.
Alright, the uvula rises is midline. Move your tongue back and forth for me. Good, lift it up. Buccal mucosa is pink and moist. There's no lesions or sores noted. I'm gonna activate your gag. All right. There's no missing teeth. Oral hygiene is great. And then the tonsils are surgically absent. Cranial nerves 9, 10, and 12 are intact. I'm gonna do a whisper test behind you here, okay? To test your hearing. So I want you to take your right ear, or right hand, and cover your right ear. I'm gonna whisper a word over here. You tell me what it is.
Football.
And then cover your left ear. Good, you got it right.
Basketball.
Great, good job. You got them both right. Cranial nerve 8 is intact. I think move your head side to side. Yeah, this way. All right, and then raise your shoulders up. Good. Cranial nerve 11 is intact. All right. So looking at, you have a midline trachea. I am going to listen to your carotids for bruits using the bell of my stethoscope. All right, what I'm gonna have you do is take a deep breath in, let it out, and then hold it. All right, no bruits noted. Same on this side. Deep breath in, let it out. And no bruits noted on this side. And check your carotid pulse. 2+. 2+. All right. I'm gonna feel your thyroid. So what I'll have you do is look down to, there you go. Any tenderness?
No.
No, there's no nodules, no goiter. All right, to the other side. Any tenderness?
No.
No nodules, no goiter noted. All right. Looking at your back, you have equal chest expansion when you breathe. I'm going to touch your back with my hands, and every time I touch you, I want you to say 99.
All right. 99, 99, 99, 99, 99, 99, 99, 99.
All right. Tactile firmicus is equal bilaterally. I'm gonna listen to your. Well, I'm gonna percuss your lung fields now.
Okay.
Here we go. All right, resonance heard throughout. I'm gonna listen to you. All right, take a deep breath for me. Lungs are clear to auscultation bilaterally. Next thing I'm going to have you do is say 99 again whenever you feel my stethoscope touch.
Okay. 99. 99, 99, 99, 99, 99, 99, 99, 99, 99.
All right, negative for bronchophony. All right, you're gonna feel me tap on your back here. I'm gonna check for CVA tenderness. Any pain?
No.
Any pain?
No.
All right, great. All right, so I'm gonna have you go ahead and lay on the bed. All right, I'm looking for jugular vein distension. I don't see any on you. I'm gonna do the 99 thing again. So anytime you feel me touch, you say 99.
Okay. 99, 99, 99, 99, 99, 99, 99, 99.
All right. Tactile fremitus is equal bilaterally. All right, I'm gonna listen to you. Lungs are clear to auscultation bilaterally. Next thing I'm going to do is I'm going to listen to your heart sounds. I'm going to use the diaphragm and the bell of my stethoscope.
Okay.
All right, starting with your aortic valve. Pulmonic valve. Herb's point. Mitral valve. Apical. Regular rate and rhythm, S1 and S2 heard, no murmurs. I'm gonna feel for your PMI. And PMI is felt. Next thing I'm gonna do is listen to your abdomen. Listen to your belly sounds. Active vowel sounds in all four quads. I'm going to do a little percussing over your belly here. I'm going to palpate your belly now. Just go ahead and slide down the bed a little bit here. Okay. First, we're going to do some light palpation. Tell me if there's any tenderness.
No tenderness.
All right, we're going to do deep now.
No tenderness.
All right. The liver edge is smooth and felt above the costal margin. Unable to palpate the right kidney. Take a deep breath. Unable to palpate the spleen. Left kidney is barely palpable. I'm going to check for pain at McBurney's point. Any pain?
No pain.
Negative for pain at McBurney's point. All right, go ahead and sit up for me. All right, I'm going to check your pulses and your other locations. We already did your carotid, so
Okay.
we're going to do your brachials. 2 plus. Radials. 2 plus. Popliteal. 2 plus. Dorsalis pedis. 2 plus. There's no edema noted. Capillary refill is less than 3 seconds. All right. I'm going to touch you. Tell me if you feel sharp or dull.
Sharp. Dull. Sharp. Sharp. Dull. Sharp.
Does it feel the same on both sides?
Yes.
All right. When you're sitting here, I'm going to have you raise your legs and then lower them and then raise your feet up off the floor. Point your feet to the sky, your feet. All right. Lower your legs. All right. Push me away and then pull me towards you and then push my hands up and then push them down. All right. Range of motion and strength is, patient has full range of motion and strength bilaterally. All right. I'm going to have you tell me if you feel sharp or dull.
Sharp. Dull. Sharp. Dull.
Okay. Sensation is intact. Go ahead and stand up for me. We're going to do some range of motion on your upper extremities.
Okay.
All right. So your arms out for me. Arms up. Cross them behind your head. Arms back up. Out. Down behind your back. Great. Your arms in front of you. To your face. All right, grab my fingers, squeeze as hard as you can, pull me towards you, and then push me away. All right, patient has full range of motion and equal strength bilaterally. I'm going to do one test here. I'm going to tap here. Any tingling?
No.
All right, negative for Tennell's. All right, have one more seat for me. I'm going to do your reflexes, okay? So the first one we're going to do is your brachial.
All right.
All right, and then relax. All right. Good. All right, and then we're going to do your tricep. Good. All right. Next, we'll do your brachials. All right. All right, and now we're going to do your patellar. All right. All right, deep tendon reflexes are intact. All right, stand up for me. Last thing I want to do is check your back for scoliosis. So, from here. All right, I'm going to have your shoulders are symmetrical and even. Your hips are symmetrical and even. Bend over slowly for me. All right, there's no evidence of scoliosis here. Go ahead and stand back up. All right, close your eyes for me. All right, Romberg's negative. All right, we're all done. I appreciate you coming in today. Any questions for me?
No, I don't have any questions.
All right, well, I hope you have a wonderful rest of your day.
You too.